Ladies and gents, welcome back. Vaccine mandates were not only a divisive issue used by politicians, but they quickly became a blight on the cause for liberty in the Western world. And now that the smoke is clearing, we're starting to see a clearer picture of just how they were brought onto the average citizen and forcing people into taking a medical intervention that they otherwise may not have wanted to do. And journalist Lee Fang is unearthing some of the tentacles that the pharmaceutical industry had, not just with government officials, but with non-governmental organizations and nonprofits. Now, before we get into that, here's Justin Trudeau's words recently. "Let me be clear, my government did not force Canadians to get vaccinated." Well, they simply took away your rights, allowed employers to force them without cause, encouraged people to hate them, restricted Canadians from traveling in their own country, banned them from restaurants, concerts, arenas, and controlled their ability to feed their family. Otherwise, yeah, they had a choice, right? Absolutely. And well, this is Justin Trudeau as early as February 11th, 2021.
In terms of mandatory vaccines won't be mandatory. That's not the way we do things in Canada.
But like I said, what do you do with someone with an allergy? What do you do with someone who's immunocompromised, or someone who, for religious or deep convictions, decides that no, they're not going to get a vaccine? We're not a country.
What do you do?
We're not a country that makes vaccination mandatory, for example.
So that's what Justin Trudeau had said at the time. And then, well, popularity grew and grew and grew to push vaccine mandates. Now, how did some of that popularity grow? And well, here Lee Fang is unearthing some of this. Pfizer quietly financed groups lobbying for COVID-19 vaccine mandates. Consumer, physician, public health, and civil rights groups received Pfizer cash, often undisclosed, while lobbying for the mandate. New reporting comes out, and here's the Substack article from Lee Fang. Pfizer quietly financed groups lobbying for COVID vaccine mandates. Many of the supposedly independent consumer, medical, and civil rights groups that created the appearance of broad support for mandates receiving funding from one of the vaccine manufacturers. In the midst of a contentious debate about Chicago's plan to force employers to require their workers to take COVID-19 vaccine, Karen Freeman Wilson, president of the Chicago Urban League, appeared on television to dismiss complaints that such rules would disproportionately harm the Black community. And a lot of people in Canada as well, when it came to Native communities, minority communities, these are the ones that were affected most by the mandates. And well, for good reason. Historically, governments have not been good to a lot of these minority groups. And well, experiments were performed on them, and well, I can understand why people would be wary about wanting to take something, especially when it's forced upon them by the good old honest government, right? Health and safety factor will far outweigh the concerns about shutting people out of creating a barrier, Freeman Wilson said on WTTW in August of 2021. Earlier that year, her group received a $100,000 grant from Pfizer, the manufacturer of the most commonly used COVID-19 vaccines in the United States, for a project to promote vaccine safety and effectiveness. Although the Chicago Urban League does not normally shy about disclosing its corporate donors, the support from Pfizer is not listed on their partners section on its website. The drug industry funding likewise went unmentioned during the interview. Pfizer's grant to the Chicago Urban League was one of the many Pfizer made to nonprofits and trade organizations. Pfizer doled out a special funding to groups across the country that lobbied in favor of government policies to mandate COVID vaccines. So this is, and I'll leave a link in the description down below so you can read the whole article for yourself. But it appears that these vaccine manufacturers started to infiltrate non-governmental agencies in order to create this facade, this idea that there was actual support within these communities for COVID-19 vaccines being mandatory, when I doubt this actually was the case. The National Consumers League, a century-old corporate watchdog group, announced support for the government and employer mandates requiring COVID-19 vaccination in August 2021, during roughly the same period which it accepted $75,000 from Pfizer, earmarked for vaccine policy efforts. We have also the Immunization Partnership, a Houston-based public health nonprofit, lobbied publicly against Texas legislation in 2021 designed to prevent vaccine passports and municipal vaccine mandates. So this stretches on, and we can only imagine it, because it's a new report, how far this reached even into our own country, and with non-government agencies and entities here within Canada. Now, Lee Fang was on what's his name, Russell Brand's show. Sorry, Russell Brand, and had this to say.
In Chicago, there was a very kind of controversial vaccine mandate. There are also discussions about vaccine passports, and a large percentage of the African American, the Black community in that city, was not vaccinated in 2021. And one of the oldest African-American civil rights groups, the Urban League, Chicago Urban League, went out into the media and was asked, would this mandate hurt the African-American community? Would it kind of push them out to the sidelines? And she was very clear in lobbying and pushing back against that, saying, no, the mandate's worth it. It's worth it for our community. She never mentioned that, just prior to that interview, a few months prior to the interview, she received a $100,000 check from Pfizer. Not mentioned during the interview, not mentioned on the Urban League's website. It's not disclosed until this morning, until right before appearing on your show.
Unbelievable. There's a whole tweet thread you can go through and read. Again, links are always in the description down below. But you can see the documents cited in this story are linked in my Substack are only a slice of the Pfizer and biopharma influence spending. So you can go in and go through a list of all these different spending organizations. Also, he was on another show here. Again, links in the description down below. You can see more of the interviews. Note, this Twitter files piece I reported on earlier this year also revealed Pfizer-funded disinformation group with inside access to social media giants helped censor posts critical to vaccine passports and mandates. We all know before Elon Musk took over Twitter, a lot of what you said, if you said the wrong thing, you would get shadow banned immediately, and your posts wouldn't go out, people wouldn't see them, and of course there was always the warnings at the bottom telling people, you're a big old liar if you said anything against this. And now we're seeing the grips of the pharmaceutical industry reaching out to big organizations across the globe, known as the World Health Organization, which is once again trying to push a treaty that we squashed down, and our own MP on the conservative side, Leslyn Lewis, was instrumental in squashing the last iteration of this. But of course, they're promoting it again. And here is British MP talking about this new treaty that they're trying to push on every nation of the world.
Of course, we know about the WHO. We know its unaccountable nature. The Director General appointed through an opaque, non-democratic process, too much power for international pharmaceutical companies. And these regulations propose the creation of a vast public health surveillance mechanism at public expense, but also, if the WHO itself has anything to go by, it would be substantially funded by the pharmaceutical industry. And crucially, as my friend from Don Valley just mentioned, it proposes that the existing powers for the WHO to make recommendations about what countries should do should be upgraded from non-binding to binding recommendations. So it amounts to a vast transfer of power to the WHO. And what would these new regulations enable? Legally binding obligations on countries to mandate financial contributions to fund pandemic response activities. It could require the surrender of intellectual property and technologies It could mandate the manufacture and international sharing of vaccines. It could override national safety approval processes for vaccines, gene-based therapies, medical devices and diagnostics. How would you give way?
Thank you for giving way. Does my honourable friend agree with me that it was through the ability to react to COVID in a very agile way, which was only possible having exited the European Union at the time, that we were able to invest, procure and then roll out the vaccine that did in fact save millions of lives? And shouldn't this be a model, as he has in fact stated in his eminently sensible speech as usual, that this should be a model for moving forward?
I'm grateful to my honourable friend, and it's certainly the case, in my opinion, that the best aspects of the British government's response were the ones that we were able to undertake using our own sovereignty, and I agree with that. The powers for the WHO extend potentially to ordering border closures on countries, travel restrictions, tracing of contacts, refusal of entry, forced quarantining, medical examinations, including requirements for proof of vaccination, and even the forced medication of individuals. And it's not just when there is indeed a pandemic already declared that these powers might be invoked. It's when there is simply the potential for such an emergency that the WHO claims this power.
Unbelievable. Unbelievable. You can't make this stuff up, folks. And this is Dr. Leslyn Lewis talking about just this treaty here. The WHO Pandemic Treaty could greatly expand the WHO's, this is the World Health Organization's, legal authority in health emergencies with impacts on national health sovereignty. Yet this hasn't been debated in Parliament. Of course, no. And you're not hearing about it on the news. This is not something that's being widely broadcast, and this is why I thought today this would be a very important thing to bring to people's attention. If you didn't appreciate the last 2 years, well, we don't want to enter in any of these agreements like this, giving away our own sovereignty, our decision-making away to some otherworldly organization, some conglomerate run by, well, the Bill and Melinda Gates Foundation, as well as, largely funded by pharmaceutical companies like Pfizer. Now, we've seen the influence that they've tried to peddle using social media, now with non-NGOs, and it's just egregious. And, well, people need to stand up. So there's a petition that Leslyn Lewis is saying to sign here for all the Canadians out there. I'll leave a link again in the description down below. You can go check out that petition, sign it, get the debate actually happening. Leslyn Lewis was instrumental in actually squashing the last iteration of this. But what needs to happen is it needs to be said that we don't want this, period, because they will just keep coming back with new treaties for the politicians in the at the current time to sign. Anyway, leave a comment in the comment section down below. Let me know what you think about this whole scenario, about Pfizer and their undue influence in all kinds of places, and how it's all coming to light now as the smoke is clearing. And we'll see you in the next one. Keep on trucking.